everyone, I'm Dr Amel from City Skin Clinic and welcome back to our channel. If you're a returning visitor, thank you so much for all your support, and if you're new to our channel, please don't forget to subscribe at the end of this video. Today's topic that I really wanted to have a chat about was what can go wrong with lip fillers. I know this sounds a little bit alarming, but I think it's really important when you're considering any treatments to think of all of the possible scenarios. So obviously the best scenario, and that's the one that we always go for and that's the most common, is that you have your beautiful lips and there may be a little bit of swelling and probably a tiny bit of bruising after the procedure, sometimes a bit more bruising depending on you and what happens, but overall the vast majority of people in our clinic anyway have lips that they absolutely love and they're super happy with. But you always, despite this, have to think about what could go wrong. And the reason that we always like to think about what could go wrong and discuss this with patients before they have treatment is so that you have a plan. If something goes wrong, and it can do, what can be done to stop it and to resolve it. The reason that's so important is that you have a plan. With the majority of things, and even if the worst case scenario happens, you can resolve it, you can stop it from getting worse. And this is not just true for lip fillers, but it's really important for any kind of non-surgical aesthetic or surgical treatment. And that's something that's really important that your doctor or practitioner discusses with you and that you ask as many questions about it. So what can go wrong with lip fillers? So I'm going to start from kind of small to big things, and I'll talk you through what they are and how to resolve them. So I'm not going to talk about bruising or swelling because these are almost a given. Some people don't get any of that and they're perfectly happy, and that's awesome, but the majority of people will get some sort of bruising or swelling, and I don't consider that as something going wrong because it's a known and very likely kind of immediate effect of the procedure that settles down. And I've mentioned them in previous videos, but I'm talking about things that can happen but aren't expected, and how we resolve them. Bruising and swelling tend to happen in the first day or two, usually the day after, sometimes straight away, but usually the day after you wake up and the fluid has settled and your lips are more swollen, and if there's bruising it's apparent. Swelling tends to go down over a few days. Bruising takes as long as it takes with you to go down, so for most people that's about a week. The thing that we worry about and we try and prevent is infection. So whenever you are putting a needle into the skin, there's always a theoretical risk of an infection. And infections are terrible because that can cause to pain, it can cause to a horrible sort of illness if it's not caught and treated properly. So if there is infection, normally the signs start 3-4 days or later after the treatment, because that usually gives enough time for the bacteria to grow and then to start the tissue response to it, and the inflammation and the immune reaction to it starts to show. So signs of infection are swelling of the area, either all of it or around it. Redness is another kind of obvious sign that we worry about that could be infection. Pain, warmth of the area. So those are all things that kind of make us concerned that it could be an infection. So the way we mitigate against infection usually is, you start by using surgical prep, thoroughly cleaning the area. Everything is sterile. We wear gloves. We make sure that, so the products are all sterile and they only come out of their wrapping just as you're about to inject. So all of these things massively reduce, if not eliminate, infection, but it's always a potential risk. So we warn patients, if these things, warmth, swelling, redness, tenderness happen, these are the things to reach back out. It's really important to manage an infection, but the way you often manage it is through antibiotics. And another reason, it goes without saying, why these treatments have to be done by a professional, and they have to be done by a medically trained professional, so either a medical doctor, a dentist, or a senior nurse, people that can spot when something goes wrong and actually immediately manage it themselves. So that's kind of the thing that happens with infection, and it's really important to catch infection early before it spreads. And everyone who goes to a medical practitioner will be counseled on what to look for, what to do. I do want to stress all of these things are incredibly rare, but it's really important to be aware of them, and if your practitioner doesn't mention them, that's a cause for concern. The next kind of thing that we obviously worry about can appear either straight away or later, so it's lumps. So lumps themselves are by no means a huge problem if they appear straight away. So that's usually, you might notice lumps in a week or two after the treatment has been performed, and it's usually because if there's a bit of swelling before and then it starts to settle, then you notice some lumps or unevenness. Usually that's a bit of the filler maybe has not settled into the layer with the rest of the filler, and it's incredibly easy to resolve that. Nearly always firm massage by your practitioner will smooth down and get rid of the lumps. Some people, if they're not able to go into the clinic, you can instruct them via video how to massage it themselves. Although at City Skin Clinic we always prefer to manage these things ourselves. So if someone comes in, if they've had lumps, just bring them in and just quickly massage it, and that resolves it. Very, very rarely you can have lumps that appear a little bit later, maybe someone's left it, they weren't quite sure, and it hardens a bit. Again, in those cases, most of the time firm massage can bring it down, but sometimes you may need to put a little bit of hyalase enzyme to just soften up and dissolve a little bit of that filler to bring down the lump. So that's the other side of that. Rarely you can have lumps that sort of appear much later. So as the filler starts to dissolve, a little bit of filler may end up developing a nodule later then. In that scenario, usually you do need to just dissolve it with a bit of hyalase, and that will sort it out. There is a condition sort of called Granuloma Formation, so very rarely some people may end up with lumps, little granulomas that have a bit of filler and have some inflammatory cells contained within them as well. And in that situation, these are very rare, but they do need to be identified early. They're not harmful, but the way to get rid of them does involve a few things. So it involves hyalase injection to dissolve the filler, but you may also be looking at giving someone antibiotics and maybe even sometimes steroids to bring down that inflammatory response as well. So again, all of these things, you can see why it's important to have someone medical taking care of you, because if they do happen, there is a process to having them resolved, but it does involve someone who is medically trained and can recognize these and deliver the treatment. So those are sort of things that are uncommon, they're rare, but they can happen. Now, the big scary one, because all of the other stuff can be resolved, and with the exception of infection, it's not super urgent. If someone develops it and they're away and they're coming back in a few weeks, you can easily resolve a lump, you can easily resolve any of those other things. Infection, you have to act more quickly, but the one that's even scary and you have to act even more quickly is vascular occlusion. And this can happen when injecting filler anywhere, but when we think about the lips, vascular occlusion is when either rarely a bit of filler gets into the blood vessel and blocks the blood supply there, or the filler is actually pressing onto the blood vessel and so obstructing the blood flow. If you have true vascular occlusion, usually people report a lot of pain. That's sort of abnormal to the response. So that's why your practitioner will generally be checking your comfort levels. Some people feel uncomfortable when they have filler because it's understandable. You're having an injection, you're nervous, but there's a sort of pain that we know is, or discomfort that is normal versus abnormal. So that's one thing. The other is if you have occluded a blood vessel, specifically an artery, you may notice your practitioner should at the end of the treatment just check that the lips feel fine, you're okay. They may be checking that the color looks normal, the capillary refill, when you press on the tissue and you let go, that's normal. These are things that we look for to make sure that there is no sign of vascular occlusion. So in that scenario, if all of that is okay, that makes the likelihood of vascular occlusion incredibly rare. But if your practitioner sort of thinks there might be vascular occlusion because the capillary refill's a little bit slow, or there was a lot of pain, or any of those signs, then what they will do, if they are a medically qualified and senior, appropriately trained person, is know to start to dissolve straight away. So as far as I'm concerned, anyone injecting filler should be able to easily use Hyalase, especially in an emergency, and have a protocol for that. It's our equivalent of the crash kit. You know how you in any clinic, including ours, you have a medical kit that includes adrenaline if someone's allergic or anything. With dermal fillers, you should also have Hyalase and a protocol that everyone who injects knows about, which is if you think there might be a bit of occlusion, or even if you're worried, it's one of those things you don't want to err on. You're much better erring on the side of caution, because you can always redo the filler. You should be able to inject straight away and tell the patient what's happening. And so it's one of those, you prepare for the worst case scenario, and usually it never happens if you're always prepared and you've got it in mind. So in that scenario, immediately, usually a lot of vascular occlusion is immediately apparent if someone's looking for it, and they can manage it. If, however, everything looks fine, we also warn patients, if you get home and you notice there's just a lot of swelling, even if you're not sure if it's a lot or you don't know, we always encourage patients to send us a picture, and we can look at it and say, maybe ask a few questions and say, no, that's to be expected, or that's not. That's one of the things. So aftercare is really important, and that kind of emergency contact ability. Pain. You really shouldn't be having pain after your treatment is done. You shouldn't have pain in the treatment because you should be numbed up, but some people, because they're nervous, they're uncomfortable, may be uncomfortable. You shouldn't really have pain, and you definitely shouldn't have pain when you go home. You might have some swelling which feels a bit uncomfortable the next day because your lip is swollen if you're one of the people that swell a lot, but pain is something that's always a red flag. You might have seen the pictures in the tabloids and stuff of people with really crazy swelling. That is not normal swelling for filler, so that's something else. Discoloration. If someone reports a whiteness or bluish tinge to their lips, that is not normal. So all of those things make us concerned, or would make us. We've never had a vascular occlusion, touch wood, because we look for it and we make sure that that's something we don't. But if any of these things happen, you want your practitioner to bring you in straight away to examine you, to start dissolving if they think there's even the tiniest possibility that it could be this. So that's what you always want to happen, and that's what stops people from, in the case of lip vascular occlusion, if you don't treat it early enough, you could end up with death of the tissues in that area. People may end up with scarring, may have to have reconstructive surgery. So it's something to really take seriously. And that's why it's so important not to be flippant about lip fillers or fillers anywhere else in the face. So I hope I haven't scared you too much, but I think it's really important to have a chat about what could go wrong, how you stop these things from going wrong, where you do your best to reduce the risk of that, but also how do you make sure that patients are monitored, you're monitored afterwards, so that if there is, in the rare occasion, something does go wrong, someone can take care of it straight away. And even with vascular occlusion, if it's taken care of straight away, you don't get any long-lasting damage or any problems like that. So that's why it's really important to have plans in place and to go, discuss with your practitioner, well, what if this went wrong, or how do I know? How do I know what's normal? How do I know what's not normal? That's super, super important. Anyway, I hope that you found this video useful. If you have any questions, please leave them below. And if there are any topics that you'd like to see us cover, again, just reach out, leave a comment below. And if you liked this video or thought it was useful, please don't forget to give it a thumbs up. If you're not already subscribed to our channel, please subscribe and ring the notification bell. Until next time.